Johnson, Senior Advisor to Deputy Borough President Ingrid Lewis Martin. I just wanted to know if anybody actually at the table picked up the press advisory. We're having a presser on rat infestation here at Brooklyn Borough Hall. And within the presser, we actually partnered with a company to do a pilot program here at Brooklyn Borough Hall with a device, which I can't give you the names and everything until the unveiling of the presser tomorrow, but we have 5 of the devices that are used. They're all environmentally friendly, and within a month's time, we've captured almost 100 rats here at Brooklyn Borough Hall. So what we're going to do is ask you to pass the information on to your committee members who sit on the health, who sit on sanitation, and any of the other members that I'm forgetting that might be interested in partaking in the press conference. Within the press conference, what we're going to have is a spokesperson from Rat Traps. That's the name of the company that we've actually partnered with. That individual, we will have the device on display for folks to take a look at. He can give you more detailed and concrete information as to how they go about installing the device, the capturing mechanisms of the device. It looks more or less like a small generator with a seal over, with a container on top of it, and inside of it, there's a area where they go up the container. It's like a step. It's kind of like a trapdoor device, and they walk up the steps to the baiting area where the food and stuff is at. And as they're eating the food, it's like a trap door. So as soon as the sensor goes off and they fall into the solution, and I'm sorry for being graphic, but they drown in the solution. But it's totally environmentally friendly. It's a different take on what we're dealing with the black boxes that have poison in it. And as you know, the rats eat the poison and they carry the poison for a significant amount of time. You could be walking your dog or anything like that, and whatever the area where they might have died at, it could be grass, along a garbage disposal, anything. If they actually eat anything from that area where the poison was contained at, they have the possibility of actually perishing as well, your animal, or it might cost you a lot. This one here is safe, it's effective, it's actually been proven here at Brooklyn Borough Hall, and we invite you all, I'm not going to be long-winded, but we invite you all to partake in it. We actually reached out to mostly all of the community boards, right? A majority of it, but we want to actually make sure that we mention it here at the board meeting so you can take it back to your members at the community board, or even any housing developments or task force, people who sit on task force within those areas to come and partake in the presser. All right, thank you. I won't take up too much of your time. I thank you for just hearing me out. Have a good day.
Any questions for David before he leaves?
Yes, good evening. Glomani from Councilmember Stephen Levin's office. So I was just curious if Department of Health and Mental Hygiene and their rodent abatement team.
I'm sorry, I can't hear you.
Is the Department of Health and Mental Hygiene, will their rodent abatement team be out there tomorrow as well? Because I understand Borough Hall was like the lower limit of this rodent
Did
rat
we
reservoir.
speak to the Department of Health and Mental Hygiene, are you saying? Are you asking me that?
Yes, I'm asking if they'll be part of tomorrow's presser.
We've sent out the
part
press
of this.
release to the Department of Health and Mental Hygiene, so everyone is welcome. We try to make sure that Parks will definitely be there. I just spoke to the Chief of Staff, Davey, under Marty Marr, so he'll definitely be there. They're showing up as well, but the media advisory went out to everyone, so we're not excluding anyone from partaking in it. The more the merrier, because we think that this is a device that can actually change the way we actually try to hunker down on the rat migration, or infestation, I should say. I'm sorry.
Thank you. I ask only because the Cadman Park, the rats are becoming an issue again, so I know that health is looking at that, and this was part of that rat reservoir 2-3 years ago. So, thank you.
I mean, feel free to share the information, like I said, because it's open to everyone, and we just want everyone to actually see what we've had going on here at Borough Hall for the past month, and we think that it could be helpful in other communities. Any other questions? Thank you.
Thank you, David. Just so we can take one step back, we're going to ask if there are any changes or corrections to the minutes from the June 4th meeting, and if we could have a motion for these minutes to be adopted. Everyone was sent the minutes in advance of the meeting. I'm sorry? I think we're waiting for a few more people to sit down, and we'll take attendance. So you want to do a roll call? No, we do presentation. You want to wait? We're going to move on to the first presentation for the evening, which is a presentation by the New York State Nurses Association. And we'd like to mention, you can sit over here, Michelle. You come up to this is, are you going to go to the podium and do? So this is Michelle Burnaby, and she's going to give us some information about the State Nurses Association, and you'll take questions after.
Yeah. So, hi, I'm Michelle Burnaby. I work at Mount Sinai West in the psychiatry department, their psychiatric emergency room and inpatient psychiatry. I also work in Red Hook at a substance abuse facility. I've been a nurse for 7 years, and I want to thank you guys for having us. The purpose of this presentation is to request from you all to pass a resolution in support of the state enactment of Safe Staffing for Quality Care Act. And I'm going to start by reading a poem that I wrote in 2017 in a way to kind of process an event that happened. So it's called, Dare I Say, God is in the Rails. The sun was setting. It was your turn to pick a song. You typed into YouTube, Ben Howard, Call Me Maybe, cover. We laughed and sang in perfect harmony. Then your stare went blank. I want a job, you know, and I want to meet someone to love. I really think I'd be a great boyfriend. Those big brown eyes, they could see more than any boy should have to. Take your medicine, okay? I don't want you to have to keep coming back here. You have your whole life ahead of you. You'll get that job, you'll find that girlfriend. Michelle, I'm so lonely out there. The voices are the only company I have. When they go away, I truly have nothing. You taught me so much about the field I was the professional in, making me question the label we slapped on you and the prescriptions we forced into you. A tortured life full of such brilliance. Sunday night, you got off those train tracks and you walked yourself to the hospital. You lived your life so perfectly. It's Tuesday morning and I can't stop crying. Tears streaming down my face, repeating, I'm sorry. I'm sorry that in 2017 we have no system to nourish eyes as big as yours. I'm sorry that we thought we knew what was best for you. I'm sorry that we didn't know how to understand you. I'm sorry that when you came to us for help Sunday night, we decided you didn't need it. I'm sorry. There was no place for you. I'm sorry, I'm sorry, I'm sorry. That like so many others, the only thing in this world with enough grace and strength to hold and support your brown body, your radiant mind, and your big brown eyes were those cold iron subway rails. I'm so sorry that you didn't die fighting your illness, you died fighting ours. B, you lived your life so perfectly. So, sorry, I'll probably get emotional, but the fact we don't have adequate staffing in hospitals is truly our illness. Everyone here at this table. We are actively choosing to not support people who are ill, who are inequipped to care for themselves. And not only that, we're not supporting the people who are giving their lives to take care of these people, which is, in an urban setting, a very hard job, which is in the public hospital setting, an even harder job. I see nurses and talk about nurses as a traumatized community. We are traumatized. Our workload is too much. I mean, we can't take care of people in crisis. People, rightfully so, then react with anger at us because we don't have enough physical resources. In my job, I have to make decisions. Like, sometimes patients don't even have water available to them because the last thing on my list is getting somebody water when someone is in danger or someone is in risk or someone is getting violent. And so that is something a decision as a community we're consciously making. And I guess I'm here to hopefully educate that, one, hospitals in this city need your help. Two, it doesn't have to be this way. California, actually the state where I'm from, and constantly wonder why I'm just not a nurse there, is doing this and, been able to sustain it for, I believe, like the past 10 years, but you can fact check. I don't remember when they passed safe staffing laws for the state. And two, if this is something that our community and our state continues not to prioritize, then if, God forbid, you or anyone you love goes into a hospital, please have a caregiver or an advocate with them 24/7, because nurses aren't equipped to take care of patients. And I'm here because I hope that we can be, and we can change laws to do that. California hospital income dramatically rose after safe staffing levels were implemented. So reasons for this is, as you can imagine, if there aren't enough nurses and we can't take care of you adequately, you actually continue to be sick. And so if we can effectively get you better, then it reduces the burden of the healthcare system. Safe staffing reduces hospital turnover. Again, traumatized community. I'm hoping to leave the field as soon as possible. Like, Crystal knows that. It's like irrational to be a nurse. You're doing it. You're like, what keeps nurses going? I don't.
Hi, good evening. I'm Crystal Rogers. I'm actually an organizer with New York State Nurses Association. And Michelle is one of our younger nurses. She's in it 7 years, and she's burnt out. She's burnt out because of the patient load. I'm with you all today, and I'm with the nurses today because I was an internal organizer in one of these public hospitals, and the staffing affects the entire hospital. I also, as a parent, Michelle is telling you that they're not equipped to care for patients. I have a special needs son, and there are times where he needs support, and I feel he may be worse off if I take him to the hospital than not having the access to care. And so that's honestly the reality that's happening in New York City hospitals, and the public hospital system is so much worse. I think people don't really understand when you say safe staffing, it means that your nurse has 12 other patients. 8 other patients, 9 other patients. So whatever's wrong with you, there's a line. Even after you're admitted, there's a line. And so folks really kind of need to just kind of digest that for a moment. I'm not sure if folks have been a patient or have family members that are currently patients, but it is a reality.
Yeah, and that means mistakes do happen. And, it's the cognitive error. The more stress you put on an individual like me, the more errors I'm going to make. And my errors aren't just like typos or not just like stapling a paper the wrong way. My errors are people's lives. They have, unfortunately, true implications. And you really want to put me in a situation where I'm not making errors.
I just want to interrupt you one more time. Michelle has been lobbying with me. We've been at City Hall since January talking to folks about safe staffing. We were successful in getting over 30 of the city council members to sign on to a staffing resolution. And I'm going to have Michelle in just a moment read a proposal for you all. But we are basically asking for a similar resolution for the borough of Brooklyn. And so, yes.
Teresa Scavo, Community Board 15. Are we talking public hospitals, private hospitals?
So we're
The
looking
cover
for...
sheet of your paperwork says nursing homes. And how did you validate these numbers?
She's going to read through the resolution. It does include all direct care professionals, all clinicians or people that touch the patient. So a nurse needs enough nurses' aides on the floor. She needs enough transporters on the floor. She needs enough physicians on the floor.
So this is public and private hospitals?
Correct.
They don't have from transporters, nurses' aides, physician's assistants, registered nurses?
Correct. We want a suffice amount of all those titles on the floor in hospitals and nursing homes.
What would you consider the right number? Patient-nurse ratio?
I think that we are calling on the state to make that decision, and so the resolution, Michelle's going to read it in just a moment, is calling on the state to pass a state bill.
California has 1 to 5.
Oh yeah,
For
I'm
nurses.
sorry, I lost my train of thought, but we basically don't want to make that decision. The governor has committed to having the Department of Health figure that out, and we think that they should figure that out.
And California is 1 to 5 ratio.
Yeah.
And you think that's sufficient?
Yeah.
I'm honestly, I'm not a person to even speak on that because I'm an organizer, I'm not a clinician. But I think it has to do with a patient's acuity and what a person needs. So, you know, a person with asthma needs less than a person that's on a psych unit or in the ICU. And so it depends on what unit you would be on. And that's why I think it's best to leave that in the hands of the Department of Health to figure out and to tell us what those ratios should be for each unit.
Okay.
Does that make sense?
Yes.
Can we just let them finish the presentation? So let's let you finish your presentation, then we'll take questions, and then after the questions, we're going to take a roll call, so.
So I'm going to read the draft resolution. This draft resolution is based on resolution number 396, sponsored by the New York City Council members Fernando Cabrera and Rafael Salamanca Jr. Resolution number 396 is calling to endorse state enactment of the Safe Staffing for Quality Care Act to ensure that all acute care facilities and nursing homes meet the minimum safe staffing ratios and standards for nurses and other direct care staff, and further calling upon the City of New York to consider pursuing similar local legislation requiring the New York City of Health plus hospital system and other providers receiving funding from or contracting to provide services for the City of New York to meet equivalent minimum staffing ratios and requirements. The New York City Council conducted a hearing on resolution number 396 on June 24, 2019. Whereas, according to the United States Department of Health and Human Services, the inadequacy of nurses and other direct caring staff levels leads to poor patient outcomes. And whereas research funded by the Federal Agency of Health Care Research and Quality has found that hospitals with lower nurse staffing levels have higher rates of pneumonia, shock, cardiac arrests, urinary tract infections, and upper gastrointestinal bleeds, leading to higher costs and higher mortality from hospital-acquired complications, and aka preventable things. And whereas the Journal of American Medical Association published research that estimated 5 additional deaths per 1,000 patients occurred in hospitals that routinely staff a 1 to 8 nurse, which is pretty typical for New York City, to patient ratio compared to those staffing with a 1 to 4 patient ratio, and that odds of patient death increased by 7% for an additional patient the nurse must care for at one time, because we can't possibly hold all that information in our head. Whereas research shows that better staffing policies not only result in better patient outcomes, but also lower the operating costs of healthcare providers by reducing the recruitment and training expenses resulting from staff burnout and turnover, lowering the penalties and reduced reimbursement imposed to penalize poor patient outcomes, and unnecessary readmissions, lowering patient length of stay, reducing legal malpractice costs, lowering staff productivity due to workplace injuries and fatigue, and lowering patient satisfaction scores and hospital quality ratings. And whereas, according to a report published by Health Services Research in 2012, nursing homes, which have safe staffing ratios, have better quality of care in their facilities and improved functional status of the residents. And whereas in 2004, California passed which required hospitals to institute minimum nurse-to-patient ratios, where studies have shown that nurses in California have improved patient care outcomes and lower workplace injuries. And whereas the Safe Staffing Quality Care Act would require all acute care hospitals and nursing homes in New York State to comply with specific minimum nurse-to-patient ratios and staffing requirements, submit a facility staffing plan to the State Department of Health, and require public disclosure of actual hospitals and nursing home staffing levels. And whereas ensuring adequate nursing coverage for all patients is an important public health goal that will improve the quality of care in acute hospitals and nursing homes, now therefore be it resolved that the Brooklyn Borough Board calls upon the legislature to pass and the governor to enact the Safe Staffing for Quality Care Act to ensure that acute care facilities and nursing homes meet appropriate minimum staffing ratios for nurses and direct care staff, and be it further resolved that the Brooklyn Board commits to pursuing the implementation of minimum safe staff ratios and standards in NYC health and hospital systems and in all other acute care hospitals and nursing homes that receive funding from or contracts to provide patient care services for the city of New York. So please pass a resolution, that too, supporting the Safe Staffing for Healthcare Act in Albany. Any questions? Yeah, just go around.
Give us one moment.
Sorry.
Before we take any questions, we're going to do the roll call. Sarana?
Hi, good evening. We're going to do the roll call where we have all 18 members here. So we're going to begin. I'm Sarana, the Director of External Boards and Executive Assistant to the Deputy Board President. Community Board 1. Community Board 2. Community Board 3.
Here.
Community Board 4. Community Board 5.
Yes.
Community Board 6. Community Board 7. Community Board 8. Present. Community Board 9. Community Board 10. Present. Community Board 11. Here. Community Board 12. Community Board 13. Community Board 14.
Present.
Community Board 15.
Here.
Community Board 16.
Present.
Community Board 17.
Present.
Community Board 18. Councilmember Barron. Councilmember Cornegie. Councilmember Cumbo. Councilmember Deutsch. Councilmember Espinal? Here. Councilmember Eugene? Councilmember Brennan? Councilmember Yeager? Councilmember Lander? Councilmember Levin? Here. Councilmember Mizell? Here. Councilmember Ample Samuel? Councilmember Menchaca? Councilmember Reynoso? Councilmember Trigger? And Councilmember Lewis? We have established quorum.
Thank you, Sarana. Michelle, Yes? Community Board 4 is also here.
Community Board 4, present.
Thank you. Okay, we just need to make sure everyone received copies of the minutes before this meeting. Can we have a motion?
Motion to approve minutes as printed.
Thank you.
Second.
Thank you.
Second, Richard Flatall, Community Board 3.
Okay. All in favor?
Aye.
Any opposed? Do we have any abstentions? One abstention. Okay. Michelle, you want to take the rest of any questions?
Yeah, question.
And please make sure you use the microphone, that you give your name and your group you're representing.
Thank you.
Okay.
Hi, Janice Morgan, Community Board 16. I just wanted to say that my heart goes out to nurses. They're some of my favorite people in the world, and so
Thank you.
It saddens me that you all are going through the challenges that you are. I read a lot of stories that come across the news, and it really saddens me that nurses are experiencing that. It's definitely not appropriate.
I appreciate that.
And so my question is, I have a million questions, but I'm just wondering, I know that so many things are changing in healthcare, and so a lot of nurses are now being pulled off out of like hospitals and some of the more traditional settings to
Totally.
go and do other types of
Yep.
care.
Mhm.
And so I imagine that that is contributing to the shortage of nurses. And so has there been consideration to incentivize people to take on nursing as a career? Because I'm curious as to whether or not there is a sufficient supply of nurses to even meet the 1-to-4 ratio that's being proposed.
Yep, that's one of the arguments against it, right? I know the way California was that there's not even a supply, but there's not a supply because I think there's not much incentive. Like you have to be a saint to be a nurse in these conditions. Like it's true altruism, especially in urban settings. California, like if I were to go live closer to my family, out of nursing school, I would have made they incentivize it financially. And they have to meet the requirements. So, we don't incentivize it, and there's not.
Part of it, I think, is that the workload is so difficult that whenever nurses have other opportunities, it's easy to go to those other opportunities. And the other part is that we don't do a great job in preparing students for nursing or introducing nursing to students. In sitting in on some city council hearings, I heard a lot about how talented you need to be as a student in math and science to actually become a nurse. And so, just food for thought is kind of, what are the science and math programs like? Is it realistic that people will have an opportunity to be a nurse? It's a competitive field. And then are there enough slots open for students? Actually, I heard in some city council hearings on how some boroughs have committed to opening up high schools that will give that opportunity for students. But it's less than a handful.
could just add that I'm actually a graduate of Clara Barton High School, which was one of the only high schools in New York City that prepared students to become nurses. They were leaving high school with their LPNs.
Awesome.
I definitely think that some of the challenges that the school system currently has is contributing to, you know, the shortage in nursing. And so there should be an opportunity for more students to enter the career from the high school setting, if, you know, especially because it's allowed and they could actually meet the qualifications, similar to all of the conversation that's taken place with like STEM education and getting people into tech jobs. Given all of the challenges with nursing, you know, schools should be opening to get students into those jobs, especially those who are not necessarily interested in college, but that could get that training in high school and be ready to enter the field.
Totally. But I mean, even ethically, like, I wouldn't mentor someone to be a nurse right now. Like, go work at Google. Go work at a company that prioritizes your well-being, you know? Because hospitals don't prioritize my well-being. They prioritize profits. And so I would talk to someone about their gifts and be like, let's figure out a way where, like, you can take care of yourself and be, like, a full, vibrant human. Because that's not what's going on in
I've heard it feels like a factory here. But they're human lives that we're dealing with. You know, I've heard that. And so that's kind of, if that paints a picture for you. The working conditions, but it doesn't have to be. And honestly, the nurses are so passionate about what they do. They are doing it because they want to do it.
Yeah.
And they would do it for free. They're those types of people. And all they're asking for is to have enough on the floor. You know, but it's, you know, hospital business.
Yeah.
Richard Flatall, Community Board 3. Thank you for highlighting the challenges that nurses face in the healthcare industry. I had a couple of questions. One, did health and hospitals take a position on the Safe Staffing for Quality Care Act?
The president of H&H, Dr. Katz, is from California, so he knows that safe staffing works. One of the first things he's done is to lift the hiring freeze that was over H&H for such a long time, because clinicians are necessary for it to run. He realizes that. And without enough nurses, the work just doesn't get done. But there's a formal response to that in there if you want to read it, Michelle, but Dr. Katz is supportive of staffing ratios. He understands it works, and he understands it's not a financial loss. So health and hospitals is supportive of safe staffing. I think it always comes down to who is going to fund it.
Okay. The second question is, when you mention nursing in the resolution, what type of nursing would that be? Is it like registered nurses, practical nurses? Could you define what the nurses are?
Yeah, it's all nursing and
All
auxiliary.
nurses,
Yeah.
yes, all nurses. Because if a nurse doesn't, if she has to do out-of-title work, if she has to do CNA work, if she has to transport a patient to another unit, that's time that she's not servicing a patient.
Yeah, which happens a lot. If I don't have enough support staff, then I'm also like passing out juices, and if I'm passing out juices because patients need stuff to drink, it's like really like water and food are not being met in our hospitals. It's like insane. But when I'm doing that, I'm not thinking about your vital signs. I'm not thinking about your heart rate. I'm not thinking about the fact you have a temperature. Those things are being missed, and that's when things happen. So all staff.
Any other questions? Go ahead.
Yes, Gail Smith, Community Board 14. I too, my heart really breaks with what is going on. But I do just have a couple of clarifications.
Yeah.
In the beginning of your draft, you allude to all of the nurses meeting the minimum requirement, which I'm still not sure of what the minimum staffing ratio is, because in your third whereas, you allude to the 1 to 8, which is not good in your opinion, to a 1 to 4. So where is it that you would like to be?
Yeah, I mean, I think ideally, and I think I said 1 to 5 for California, I think it's 1 to 4. I think you're talking to me, ideally, it's like California can do it, like, pardon my French, why the fuck aren't we doing this? But I just don't get it. But the politics of it is there's going to be a study, and the study is going to, right, there's going to be a study, and the study is going to figure out what's best for New York State.
So in New York State, it's 1 to 8?
New York, we don't have ratios. I've had 12
Right, each
patients.
hospital decides on its own what its ratio should be, and then they don't stick to their own ratio that they made for themselves.
All right, so then I go back to the first thing when you're saying meet the minimum requirement. Do we know
So we
what
want
that is?
basically the state of New York to set a minimum requirement,
okay.
number one, and then for folks to meet that requirement. Because right now, each facility is coming up with their own ratios, but they are not even meeting those ratios. And there's no accountability because there are no state ratios. And so if there were state ratios, we're hoping that there would be an accountability factor and folks be able to say, hey, I went to the hospital today, I didn't see my nurse for 2 hours, how many patients does she have? And that it's a real conversation that folks are knowledgeable about.
Yeah. The accountability is patient advocates, family members, the Department of Justice, when someone gets hurt, a patient gets hurt, like, it's the
So then
accountability.
perhaps you should say then set the minimum requirements instead of meet the minimum requirements.
Okay. Any other questions? Yes.
State your name and board.
Brooklyn Community Board 5, Melinda Perkins. Just speaking to the language in the draft, I think there should be more clarification as to what it is we, want to support, and maybe it can include that we're pushing for that study to happen so that they can actually lay out different scenarios and what that would require on a nurse-to-patient ratio. And in addition, just to speak more to CD16's point with incentives, that's something that should be included as well. When things like this are passed, you want it to be as clear as possible so that it's not left in the hands of, other state officials to come up with numbers that we may have to then go back and speak to or push for, a lower number or a higher number depending on the hospital or depending on the service. So is there a way for us to add that in?
The study is actually happening now. So the study, I'm sorry, I don't know the exact date off the top of my head that the study started, but the study is actually currently happening now. And I think folks felt comfortable with the Department of Health setting staffing ratios or doing that study to make recommendations. Once the study is done and there are recommendations, then there's a conversation as to what those ratios should be. But we're not there yet, if that makes sense, because the study is actually happening. And so they haven't come up to say one way or the other, if it's 1 to 5, 1 to 8, they're studying now. They're doing the research now. And so when they come back and they have any recommendations, that's the time to, have a public hearing and to have input and for folks to give their opinion on that, on what they've come back with. Because if we did it, they would basically say, hey, the New York State Nurses Association came up with this, we don't like it. If the Department of Health comes up with it, I think that's a safe place, a safe entity for it to come out of the study. Does that make sense?
Yeah, it does in that degree. How about the whole conversation around incentives and getting more people to go into the career and what type of support is actually needed? Because who could speak to that more than you all on, some of the disparities, I guess, in your particular career and what it would take for stress reduction methodologies and, you know, all of those kinds of things to happen as a part of the Safe Staffing Act.
Yeah, I mean, to me and in my experience of a nurse, it is just safe staffing. Like, you know, because it's not, I mean, can you imagine what it feels like to, like, know someone got sicker because of you? I mean, it's not because of you, it's systemic. But, like, I mean, the term is moral injury, right? Like, I'm consciously choosing to participate in this broken system where I'm, like, sometimes making a difference, and sometimes, like, people are dying because of a mistake I made. Like, yeah. So like, but when I have 5 patients, I love being a nurse. I love it. When I have 9 patients and 10 patients, I am like running, not walking, to like Indeed.com to search for a new career. You know what I mean?
We're losing a good nurse like Michelle because we don't have safe staffing. 7 years in, she should have 30 years more in her, but 7 years in, she's burnt out. That's the reality of it. And I agree, we do need incentives. I think we need to recruit earlier. We really need to get into the school systems and collaborate. And I think that there are not that many choices for folks if they do want to pursue nursing.
Yeah, and I will say it happened 3 years in, and then I went to Sloan Kettering, and I was like, oh, Sloan Kettering has to be better. Sloan Kettering's not better. And then I went to like work with rich people, and I'm like, oh, rich people have to be doing better. And that's not even the case really either. So, yeah, it happened after 3 years in a hospital setting. And now I'm just like, I just need a new career. But I also like care about people, and that's why I'm here, to be like, we can do better. Like, it is a societal illness. Like, we are collectively making decisions that are killing people. Yeah, so I'm here today to help educate, because I don't think anybody wants to do that, and it can be done better. We can do better. It doesn't have to be this way. It's the sick, it's the needy, and disproportionately affects people of color, because NYU looks different than public hospitals. Bellevue, yeah.
CB8?
With Brooklyn Community Board 8. I'm the chair of Brooklyn Community Board 8, and I think I'm hearing you say that rich people did not get the appropriate level of nursing care either. So that concept redounds to whatever facility these wealthy patients were in, it's up to the facility to enforce the appropriate level of care. Am I interpreting?
100%.
Correct.
Yeah. Thank you.
Yep. And it's still bad at places like NYU, Cornell, and Sloan Kettering, but it's better than Bellevue, Lincoln, public hospitals.
It's horrible in the public hospital system.
Do you recall what those ratios were?
I mean, you can speak to the public hospitals. I've just been a patient in an ER, so I can tell.
8 is a good day. I'll leave it at that. 8 is a good day.
And 8 is an impossible day for a nurse. But, yeah. If you talk to places like NYU and Cornell, they aim for 4 to 5, because that's what all the studies, like New York hasn't done their studies, but it has been studies. There has been studies, the Medical Association, JAMA, like the whereas says the studies that have been done. We've studied it, we know. It's not like, you know, intuition is telling us we need more staffing ratios. We know. And it's not being prioritized for financial reasons. This is our, yeah, just like knock on wood, you don't have to be in a hospital.
Hello, I'm Joyce Simmons from Councilmember Inez Barron's office. I just wanted to know the task force. The study, is that by a task force, or is it just the staff of the agency?
I believe that it's Department of Health. There are some nurses on that committee. I'm not sure of who's on the full committee, but there are nurses involved. There are nurses on the committee.
So it is like a task force?
Yes.
Okay. And I just wanted to reiterate to the best of your ability to set some recommendations, because if you leave it up to the state, you know, you might not get the results that you want to get, and it would be great to have, you know, an advocacy voice saying, these are the numbers that we would like to see. So I know it's, you know, kind of a lot happening, and you know, in the advocacy organizations, maybe limited in terms of resources and time and everything like that, but I just wanted to, you know, just kind of put that out there. But if it is a task force with nurses in the field, with entities that, you know, are really on the ground and know the work, and you feel you can trust them to really get in there and try to push the envelope, you know, then that's definitely a positive.
Yeah.
And I wanted to just say, Councilmember Barron is the chair of the Higher Education Committee that oversees the City University of New York.
Oh, cool.
So perhaps, you know, that could be maybe a hearing topic to talk about the nursing programs in higher education, because students will graduate with these theoretical degrees, but not necessarily things that might be on the ground, jobs that they can really be put into, that's going to be put into practice right after they graduate. So maybe that's the discussion that we can have.
I think that came up around the budget hearings, and I think that Councilmember Barron actually spoke exactly to that.
Oh, okay.
Yeah.
So I wasn't even there, so you know, we're thinking.
Yes, it came up in the budget hearings, and yeah, I mean, we would be.
Yeah, so that would be a great follow-up, so we can see how we can get these students that are there into the field and into the on the ground doing the work. Thank you. Workforce, yes.
Are there any other questions? Okay. Thank you.
Thank you. I appreciate it.
Councilmember Eugene.
Oh, cool.
Thank you so very much. I'm pleased to be here. My name is Matthew Eugene, and I'm the New York City Council member representing District 40 in Brooklyn. I wasn't, you know, on another meeting. I said to myself, I got to rush to come over here before the presentation ends. And then, first of all, let me take the opportunity to thank all the members, the representative of all the community boards, for the wonderful job that you're doing on behalf of New York City, because I used to be a member of the community board also myself. Many years before I was elected, community board 14, I used to be a member. So thank you so very much. But I want to take the opportunity also to thank all the wonderful people from the New York State Nursing Association for your advocacy, for what you are doing. I come here specifically to support your effort and your fight for safe staffing. I'm talking about that because I know firsthand what I'm talking about as a medical doctor myself, and my wife is a nurse. She has been practicing many years. Let me tell you something. I usually say that, and I say that to all my colleagues in government. Health should be on the top of our priorities. The reason why, we are all fighting for jobs, for education, for housing, and I love saying that. If the people, they are not healthy, forget about the beautiful houses, forget about the affordable housing, the money that you have, the job that you have. There's nothing you can do without health. And in order to protect the health of the people and to provide the best quality of health care, we need the nurses. And the nurses are the most important asset that we doctors or we people in the medical field we have. And guess what? They are human beings also. We got limits. We have dedicated nurses, qualified nurses, people who love what they're doing, but at a certain time, doctors get sick too. Nurses get sick too. At a certain time, your body says, you got to stop. You got to stop. And I think it is fair for all of us to get involved and to ensure that the Safe Staffing Act legislation pass. It is about the patient safety, not only about the nurses. We are talking about fairness for the nurses, justice for the nurses, but it is about the patient safety. Because once somebody a human being has about 15, 17 patients to take care of, it is not easy. And I used to see my wife coming from work. She said, honey, I cannot do anything anymore. I got to go to rest. It is a very demanding career. They work hard. They love what they are doing. I think it is fair. It is a question of human right for the patient, and human right for the nurses also. I'm just here to say to all of you from the New York State Nursing Association, you are doing that not only because you need a good working environment, a safe working environment, but you are doing that also for the safety of the patient, and also in order for our patients to receive the best quality of health care. And we cannot provide the best quality of health care if we don't provide to the people who are providing health care to the people the best working environment and also safe staffing. Thank you very much. Thank you.
Thank you.
Thank you, Councilmember.
Thank you, Councilmember. At this time, I guess that concludes our business. Michelle and Krista, we thank you both for being here tonight.
Thank
for
you all.
Board.
Thank you.
Thanks, guys.
So at this time, do any of the members of the board, Borough Board, or their representatives have any unfinished business? No one? No unfinished business? Is there any new business? Does anyone have new business? Okay. Well, we have one of our Borough Hall staff, Hercules Reed.
Good night, everyone. Thank you for taking the time to be here with us. My name is Hercules Reed. I'm one of the newest employees here at Brooklyn Borough Hall. I am the assistant to the Deputy Borough President, Ingrid Lewis-Martin, and also community coordinator. Since I've been here, I've been working with the Borough President's office to conduct a profile report on the community boards in Brooklyn. This report includes the composition of each board, such as who served in the leadership and the demographics in 2018. We are requesting from each of the community boards to share with us as soon as possible who their leadership consisted of in 2018 for our report that we are creating. This response should include chairperson, first vice chair, second vice chair, secretary, and any additional executive positions your community board may fill. Also, a list of the committees and who the chairperson is on that committee was. Please note that many of your offices have recently been contacted by me regarding 2019 updates, but we're requesting what was in 2018 for the report purposes. I will send an email with the similar information out to you all, probably tomorrow, and I hope to hear back from you soon. Thank you.
Question.
Yes.
The committee list, thank you. Ethel Tyus with CB8 again. Your study is gathering a committee chair list or committee list of all the committee members on individual committees, or
yeah,
what's the level of specificity?
What I'm requesting from you guys is specifically your chairperson and executive members. We already have on file the membership, but in the report they want to know which of the members served in any leadership positions. So your information would assist with that part.
Thank you.
Yes. Sorry, can you state your name? Okay.
So what you're just saying is the list of the committees and the chairs of those committees plus the officers.
Correct. Thank you.
Thank you.
Any other?
Yeah, was the request already, I'm sorry,
Say your
Richard
name.
Flattoe, Community Board 3. Was the request already sent to the district managers?
No. So as I was mentioning, I did reach out to some of your offices regarding 2019, any new changes. So if there was a new chairperson, a new vice chair that recently got elected, that was what I reached out for prior. So you might have heard about that. This is a new request that I have not sent out as of yet, but I figured I would let you guys know first, and I'll be sending out an email tomorrow to follow up. Yes,
Please.
with the hat. Community board, what is that, 2? 1?
Alice Fuller, Community Board 1. So you're saying you're asking for the information?
Please state your name.
I said it, Alice Fuller, Community Board 1. I'm sorry. I guess the mic is not working. Is it working?
It's fine.
You make me forget my question. Let me just try to. You're saying that you want the information from 2018.
Correct.
In the future, like 2019 and going forward, if new officers are elected or appointed to committees, you want us to inform you of that?
Yes, please.
Thank you.
Is there one more
Yes.
question?
Yes, I have an unrelated notification to Borough Hall that my office, Brooklyn Community Board 8, this is Ethel Tias again, we do not have telecommunications and information services. Windstream, the new telecommunications services provider, is failing badly at their job. Their technical services staff are misinformed and are not helpful to the borough or to the board office staff. Just wanted to post that.
Thank you.
So with that note, we just want to make sure that if you guys have any problems with your district office, that you do send an email to the Deputy Board President. I know that we have been communications with CB17, so if you have an issue in regards to your particular district office, please notify us as soon as possible via email so we can make sure that we're in the loop.
It may be a while. We're cut off.
Yeah, but you guys have been very effective emailing.
Once
So-
we get the capability back, we'll bring you up to date.
Will do. Sounds good. Thanks.
Thank you.
Any other questions for Hercules Reed? Thank you, Hercules. All right, at this point, is there any other new business? No one has anything new? So our next meeting will be held on Wednesday, October 2nd at 6 p.m. Can I have a motion to adjourn today's meeting? Yes, Ms. Fuller?
Are we going to vote on the safe staffing resolution?
No, there's no vote tonight. So the next meeting will be October the 2nd, the Wednesday, that's due to the holiday. And then after that, the next meeting will be November the 6th, that's due to the election that's on the 5th of the Tuesday, so.
So you're not voting on this resolution?
No, we're not.
I have a recommendation for my fellow community board members that Ethel Tias again for CB8, that we bring the proposed Safe Staffing for Quality Care Act resolution in its draft form to our seniors and health committees, generate the support that we need to demonstrate to the state and whoever else, the feds especially, so that our hospitals are compensated and monitored appropriately to take this additional step to make our less fortunate borough residents safe when they're in hospital. So giving the timing on when I receive this, I have to give it to the CB8 Seniors and Health Committee so that they can review it and bring back a reso to the CB8 full board and then back to our legislators. Thank you for this opportunity. I appreciate it.
Thank you. So can we have a motion to
Teresa
adjourn?
Scavo, Community Board 15, motion to adjourn.
Thank you, Ms. Scavo. Yes?
Second.
Community Board 11? Thank you.